A1 Healthcare presents 6 early signs of pregnancy before a positive pregnancy test. Doubtful what the early signs of being pregnant are. Whether you've been trying to get pregnant for a month or a year, with anticipation, you're probably wild, not just welcoming a new little bundle into the world, but more immediately, finding out if you're officially positive this month. Antibodies to detect human chorionic gonadotropin, a substance produced by the developing placenta, are used in pregnancy tests. You are most likely to be able to detect pregnancy starting at 4 to 5 days before your missed period, using ultra-sensitive early pregnancy tests, even though the tests are only about 50 to 75% precise this early. Those days between TTC and getting a positive result can be both super exciting and nerve-wracking. While there's no guarantee, there are certain changes you can look out for during this time. Here are 6 early signs of pregnancy before a missed period or pregnancy test. Number 1. Cravings. Early in pregnancy, hormonal changes could cause food cravings or aversions. Throughout your pregnancy, these changes in your food preferences may last. Number 2. Breast changes. If you find that your girls are more voluminous, changing in color, or super sensitive to touch, this could be a red flag that you are expecting. And maybe a sign to indulge in a new bra, too. Number 3. More frequent pee breaks. There may still be no baby kicking your bladder, but that does not mean that the never-ending pee breaks will not begin as early as a few weeks after conception. Your kidneys work overtime to get rid of toxins in your body, and, yes, your hormones play a role, too. Keep drinking plenty of water, and think of your potty breaks fondly as a way to chill throughout the day for a few more minutes. Number 4. Raised basal body temperature. If you're taking your morning temperature to chart your cycle, you might have noticed that your temperature often dips the day before your period arrives. If you notice that your basal body temp is staying high, even when you expect your period, you might be pregnant. Number 5. Fatigue. If you're working, going to school, or taking care of a family and kids, you are probably already pretty beat. But we're not talking about the usual craving for a quick Sunday nap. We're talking about the overwhelming need to sleep, at work, at school, or at the dinner table. Progesterone produced during pregnancy can make you extra sleepy. Number 6. Nausea. Although morning sickness does not usually appear until about 6 weeks into a pregnancy, it can strike as early as 3 weeks. Take any chance you can sleep, or at least lie on the couch and binge on Netflix because tiredness is linked to more nausea. If you're taking a pre-pregnancy prenatal vitamin, it might make you a little queasy. With food and a calcium-based tummy soother, try to take it at night. Vitamins may also reduce nausea with extra B6. For more severe morning sickness, talk to your provider. There are medications she can prescribe to help you take your upset stomach. How soon can you take a pregnancy test? Your provider could always run a blood test, which can typically detect pregnancy as early as 1 week after conception. Of course, if you can be slightly more patient, home pregnancy tests can let you know pretty early, too. You can use some of the more advanced early home pregnancy tests as soon as 5 days before your missed period. These tests' accuracy usually hits 99% if you can wait until the day of your missed period. Maybe that's why 2 tests were put in the box. If you liked this video, hit the subscribe button to receive more like it in the future.